The rates for that primary endpoint were remarkably similar between TAVR and surgery after 5 years.
Really? How similar?
So the Kaplan-Meier estimate for that composite death from any cause or a disabling stroke, it came out at 15.5% for TAVR
Okay.
and 16.4% for surgery.
Yeah, that is close.
It really is.
Yeah.
The p-value was 0.47. So, statistically speaking.
No significant difference. It could easily be chance.
Precisely. The main outcome, basically the same at 5 years.
Okay, that's a huge finding. Let's break that down a bit more. What about just looking at death from any cause, all-cause mortality?
Again, very, very similar numbers. All-cause mortality was 13.5% in the TAVR group.
And surgery?
14.9%. The p-value there, 0.39. So again, no statistically significant difference.
And disabling stroke on its own?
Also very close. 3.6% for TVR patients and 4.0% for surgery patients. P-value is 0.57.
So looking at the big hitters' death, disabling stroke, TAVR, and surgery look neck and neck at 5 years in this low-risk group.
That's the picture emerging, yes.
Yeah.
They also looked at why patients died, cardiovascular versus non-cardiovascular causes.
Ah, interesting. What did that show?
Well, cardiovascular mortality was 7.2% with TAVR and 9.3% with surgery. P-value 0.15.
So a slight trend favoring TAVR there, but not statistically significant.
Exactly. Didn't quite cross that threshold. And non-cardiovascular deaths were almost identical, 6.8% in TAVR, 6.2% in surgery, p-value 0.73.
So pretty much the same risk of dying from non-heart-related causes.
Correct. And they did something else important, too. They did a sort of sweep, checking the vital status at the hospital sites for patients lost to follow-up.
Oh, good. To make sure missing data wasn't skewing things.
Precisely. And even with that check, the all-cause mortality rates stayed super close, 14.7% for TAVR, 15.2% for surgery. P-value 0.74.
Okay, that really strengthens the finding that overall mortality is similar.